Hi, my name is Hannah Kim, and thank you for attending this presentation about how HGAPS has responded to various crises in our communities and how our involvement in service has changed over time. Just for some background, I'm currently a postbac fellow at the National Institute of Alcohol Abuse and Alcoholism with the NIH, and I have been a member of HGAPS since its founding in 2016. I served as treasurer of HGAPS for 2 years during undergrad, and also over the course of my involvement, I've had the privilege of being involved in most of the crisis response initiatives that I'll be discussing today. I will include several links and QR codes throughout this presentation, so I encourage you to pause and interact whenever you'd like. So the reasons why HGAPS first started doing crisis response is really captured by these 3 goals that we still hold: to crowdsource evidence-based information from professional societies, repackage information in digestible form, and to disseminate to those who would benefit. All of this happens as rapidly as possible whenever these crises occur. So when we think about the organization's vision of bridging the gap between clinicians, researchers, and the public, we also recognize that there are times where we need to go beyond our regularly scheduled content to close that gap. So while our work as a service organization has often been atypical, being that it primarily exists online and we benefit people that we might never meet face-to-face, our crisis response initiatives have only succeeded through our members and our partners' dedication to the tenets of public service, primarily those like generosity and the motivation of reducing harm and suffering. I'd like to bring your attention to the second point here about repackaging information into digestible form. So a lot of organizations and professionals will publish or share content that has high quality and science-based information about a current event that is impacting a lot of people, such as a hurricane or a wildfire. But this information might not be reaching the public and the people who need it most. For example, most people's first instinct in a crisis is probably not to look up the American Psychological Association's website. They might be scrolling through Twitter for the latest updates, or maybe Googling the urgent questions that they might have about their situation. So we need to be able to meet them where they are, and trying to accomplish that has taught us a lot about what HGAPS is capable of and also what we want to do in the future. So this page is just to kind of show you what we mean by visually engaging content. So studies have shown that when people are presented with 2 sets of information, they will be more inclined to not only read, but also absorb the one that's more visually appealing, regardless of the quality of the content that is presented. So the page on the right comes from APA's home website, and the image that's on the left was created by HGAPS and essentially contains all the key points of the page on the right. You can see that the page on the right is, while it has good content, it might not be something that someone really feels inclined to read if they see it on social media, for example, where, you know, on Instagram, there's lots of colorful images everywhere, and on Twitter, there's always videos and GIFs and other things that are just visually attractive. And so we want to do our best to meet them where they are, as I said, and try to make content that is visually engaging enough to hold their attention. So the leadership and the structure of crisis response in HGAPS has changed quite a bit since it first started. So at first, it was something that was really just undertaken by undergraduate student leadership. This was usually done outside of meetings and done during people's free time, you know, between classes, between studying, other extracurriculars, lab work. It was really done as something that is out of the way even for the average HGAPS member. And this really started with the Parkland school shooting was the first major crisis that we did respond to, which I'll talk about later. And eventually we kind of evolved our crisis response initiatives into more of a team-like structure within HGAPS meetings. So this was first presented when we responded to the Pittsburgh synagogue shooting. This was a team that was led by graduate student Josh Langfus. And we have since also incorporated teams into our regularly scheduled meetings that talk about a variety of topics. And more recently, some of those teams have included telepsychology and discussion of COVID-19. And some of the new directions that we are considering for crisis response are having designated leadership positions of people who are really in charge of finding things to respond to and organizing those efforts. We are considering those people at both the chapter and the national nonprofit levels. And we are also considering putting together a mailing list or something that can virtually coordinate teams of volunteers that are just interested in doing this kind of thing. So as I mentioned, the first major crisis that we responded to was the Parkland school shooting. This happened in February 2018. And since then, HGAPS members have kind of made school shootings a really central thing that we do respond to on a regular basis through social media. Unfortunately, since then, there have been at least 5 other major mass violence events for which we tried our best to respond by disseminating the resources that we've built on in the past. So these pages are all crowdsourced with information from psychologists that are specializing in community resilience and other trauma-related issues that affect communities that are impacted by mass violence. And namely, we have built a lot of infographics for disseminating that information in a visually engaging way. All of this work has been done by undergraduates within HGAPS, and each time that we have had to share this information, we have built on what was already done in the past by adding new information and partnering with new people and organizations. So this is just an example of some of the infographics that were made for responding to school shootings. So on the left, we have an example of what an infographic would look like that is targeted towards a parent audience, especially parents of young children that might, have trouble understanding and comprehending trauma. And we also have things that are, educating the audience about when it might be the right time to seek professional help, and also just ways to build resilience that they can work on their own. So along with the page about dealing with school shootings, we also built pages about psychological first aid. And so both of these pages give schools, parents, adolescents tools to cope with these violent events, and also kind of looking at the community-wide and personal level trauma. And we also included new infographics with this page that were circulated in these communities. So this is an example of what is included with the psychological first aid page. We have some tips about self-care after experiencing trauma, as well as just, reassurance that what they're feeling is a normal response, as well as other information about, maybe reaching out for help if that's the way to go. So this page, while similar to the previous two, was based on the Pittsburgh synagogue shooting and just the recognition that not all mass violence events happen in school settings. Obviously, in this case, there were culturally sensitive issues at play. And we also included with this page vignettes illustrating possible responses that people might have to these kinds of events, along with different coping strategies and how to support the people around you. And this is an example of one of the flyers that was circulated in the wake of the school shooting that happened at UNC Charlotte. And on the right, we also have an example of an infographic that we made with a Spanish translation. Obviously, it's not as great as we would hope, and we're still continuing to work on getting things translated and working with multilingual people to kind of expand our resources that are offered to people that don't just speak English. One of the other major categories of crisis response that we have been engaged with is natural disasters. And the big page that we have is about hurricane and flooding preparation. And this was made in response to Hurricane Florence, which hit North Carolina particularly bad. And our school also was right next to a Red Cross center that was sheltering people for extended periods of time that were affected by the hurricane and displaced. And we really worked with a lot of local psychologists and just people that are experienced with dealing with community resilience and trauma. And we built this page within 2 days of being notified that Hurricane Florence would be hitting. And so we were able to actually disseminate these infographics and these pages before the hurricane actually landed. Obviously, we continue to disseminate them and build upon them further after the hurricane. And this event was also unique in that we had the chance to actually interact in person with some of the people that we were serving by going to the shelter and putting up flyers there with some of our resources. These pages have also served as the model for the Coping with Wildfires pages that were built by our team at UCLA in response to the California wildfires. These are just a few examples of the infographics that were made in response to some of these natural disasters. We gathered a lot of information from a variety of websites, including FEMA, the Red Cross, APA, and other psychological organizations. And these were also some examples of what were distributed in person as well. And this is just a couple of pictures of our experience volunteering at the Red Cross shelter. We put up some flyers and also tried to help where they needed it. And so now I'll talk about, what our dissemination efforts actually look like on social media. So usually when we do a social media post, we tend to go to Twitter, which is, updated in real time, and we tend to get the most engagement on Twitter. We also have posted on Facebook and Instagram for things that are specific to the UNC system or the UNC school. And we have also shared our resources on professional networks for clinicians to share with their clients, as well as school administrations to share with students. So on the right, we have an example of one of the tweets that we did in response to the shooting in El Paso. And this was just an example of how we might include and incorporate our infographics as well as just resources that are linked. Some of us have also done some analyses of these dissemination attempts and trying to see if they actually had an impact on page views and how many people were actually seeing our content. And just as an example, our top 4 pages were all in response to some kind of crisis. And I'll talk about the 13 reasons why later. But the other 3, the hurricane and flooding preparation and tips, psychological first aid, and dealing with a school shooting, those were all made in response to specific crises, as I mentioned previously. And you can see that these did have a significant impact in increasing our page views before and after the dissemination attempt. This is just a graphical representation of that information. So earlier this year, we really had to ask ourselves as an organization what we really think of as a crisis. Is this just natural disasters and violence? Could it include trending TV shows like 13 Reasons Why, or more recently Euphoria and other similar shows and movies? Is the increasing suicide rate also considered a crisis? What about COVID-19? And then also, what about systemic racism? And as HGAPS grows as an organization, it might make more sense to narrow down our focus. But for now, we see any opportunity for us to affect positive change for a cause that our members are excited about as something that is worth pursuing. So we also recognize that the special cases of COVID-19 and systemic racism are issues that are at the forefront of society, and they really serve as critical obstacles to the mental health and well-being of our population. So we see the last two in particular as things that, that might not be acute crises, but are things that are extremely detrimental to our communities, and that we have the ability to do something about them and to try to share resources. So these last few slides will just showcase some of our most recent work with COVID-19 and anti-racism. So for COVID-19, HGAPS members at UCLA and UNC work together on multiple pages to cover a breadth of topics related to COVID-19. So we have 3 separate pages right now that are really extensive and covers slightly different angles of the issue. So we have one about coronavirus and epidemics, and we also have one about outbreaks of infectious disease, as well as one about social isolation, since that is something that a lot of people have been struggling with. We also have specific pages for clinicians that are providing psychological services, as well as patients who are trying to seek help during the pandemic. And these telepsychology pages are covered in more detail by Emma Choplin's talk. Lastly, our anti-racism pages are being built in partnership with Dissect, which is a new organization, Dissect being short for Dismantling Systemic Shortcomings in Education and Clinical Training. And Dissect was made by a group of graduate students who are currently getting trained in clinical psychology, who recognize that there are aspects of their programs that could be better addressing a more anti-racist perspective in psychology. So these resources are really intended to educate and collaborate with clinical psychology training programs, and really just maintain a dialogue about racism and psychology and how we can all do better. So finally, I'd like to share with you some links to keep in touch with us and get more updates about our resources as they come out. So as I mentioned earlier, Twitter is really our primary platform in terms of social media, and pretty much all of our resources are hosted on Wikiversity. We also have our own website, the HGAPS website, which is just hgaps.org. And this website really kind of showcases all of the things that are going on with our organization. And lastly, if you have any suggestions or feedback, please feel free to reach out to us over email at suggestions@hgaps.org. Thank you.